Assalamu alaikum. This is Sayyeda Urmia Afzal from 4th Prof Morning. My roll number is BP1650233 and the topic of my presentation is contraception and my subtopic is diabetes, that is contraceptives in diabetes. So what is contraception? Contraception is basically a process prevent pregnancy by interfering with the normal process of ovulation, fertilization and implantation. So, contraceptives include birth control pills, also known as contraception, is designed to prevent pregnancy. Birth control method may work in a number of different ways, like preventing sperm from getting into egg. Contraceptives, that is birth control pills. Birth control pills are kind of medicine with hormones. Birth control pills come in a pack, that is you can take one pill every day according to your physician. So the pill is safe, affordable, and effective if you always take your pill on time. Besides preventing pregnancy, the pill has lots of other health benefits too. The hormone used for this therapy is estrogen and progesterone, and the combination of these two is called combined oral contraceptives. Sometimes only one hormone is also included, that is commonly progesterone. So the pill is called progesterone only pill. Beside that, further other like devices, implants and intrauterine devices, intrauterine systems are also present. Contraceptives in diabetes. So the women with insulin dependent diabetes mellitus require effective contraception since they are serious risk of both mother and fetus in case of unplanned pregnancy. Birth control pills, patches, implants, injections and rings are generally considered to be safe form of contraception for diabetic women according to American Diabetes Association. Estrogen in birth control pill can raise blood glucose level which increase diabetic resistance to insulin and may require an adjustment in insulin she receives. So, the oral contraceptive may worsen glucose tolerance due to the effect of progesterone decreasing diabetes, except in women with the history of gestational diabetes. So both estrogen and progesterone has different impact on diabetes. Like progesterone maintain blood glucose level in pregnancy, also provide glucose to the fetus, but increase in progesterone up to its limit may cause gestational diabetes. So the further treatments are there according to the patient condition. A triphasic pill with lower progesterone dose decrease insulin sensitivity more than a combined pill in both normal women, and usually we suggest progesterone pill in diabetes. Low dose progesterone triphasic and natural estrogen progesterone combination oral contraceptives can be recommended as a safe diabetics. Because of the effect of estrogen, some physicians do not prescribe hormone based birth control for some diabetic women. So, COG, that is combined oral contraceptive with low dose of estrogen like 20 to 30 microgram and third generation of progesterone like desogestrel is safely used in diabetic patient in type 1 and type 2 both. The ADA says that the combination of birth control pill containing synthetic estrogen and norgestinate are best for women with diabetes. Some factors to be discussed here, that is higher glucose level resulting from the estrogen in birth control pills may require an increase in diabetic women needs for insulin. Some physicians recommend that diabetic women take birth control pill with lowest dose of estrogen possible for effective contraception. Studies indicate that the diabetic women who take birth control pill for more than 2 years may increase their risk of experiencing complication like there are many complications are there like disease, neuropathy, eye condition, diabetic retinopathy and several other side effects. So the case study is here. A 24 years old patient present to the clinic today for contraception counseling. Her last pregnancy ends at 34 weeks. She had gestational diabetes and preeclampsia, currently not using any form of birth control. So the periods were normal, last in 5 days, occurs once in a month, no dysmenorrhea. Patient has medical history of HTN, that is higher blood pressure, and CHF, that is congestive heart failure. Patient is taking Lasix 40 milligram and lisinopril 40 milligram daily. She sees cardiology every 3 to 6 months, but no complication occur recently. Her weight is 95 kg, height is 5.6, BMI is 57. Blood pressure is 126 by 72, HbA1c was 6.5 before and after pregnancy. Recent reports also shows that HbA1c is not normal. It lies in 6.8%. Patient is desired for depot for birth control as she had gestational diabetes when she was pregnant. What is the most important to examine in the patient for this visit? Is depot a good choice? If not, then suggest other medications. So further, we discuss here soap notes, that is subjective. The subject is age of the patient is 24, gender is female, her weight is 95 kilogram, height is 5 feet 6 inches. Complaint is gestational diabetes, then diabetes. History of the patient is hypertension, gestational diabetes, preeclampsia, congestive heart failure. Current medication that she is taking is Lasix 40 milligram and lisinopril 40 milligram. Object is blood pressure 126 by 72, BMI is 57, HbA1c is 6.8. Lab reports recent HbA1c report is provided, so no complication are related to CHF in recent reports. In recent reports, CHF and HTN is normal. So the sign and symptoms that she's not taking any contraceptives. She previously had gestational diabetes. Her pregnancy was ended. She has a sign and symptom of diabetes too now after the gestational diabetes because her BMI is too high, which shows she's too obese. Now she is desired for depot, which is a birth control injection. Assessment: patient last pregnancy at 34 weeks, she had gestational diabetes. History shows preeclampsia in pregnancy, which is characterized by higher blood pressure. Now after medication turns to normal, her BMI is 57, which is too high, which shows patient is extremely obese. Previously not taken any contraceptive, her blood pressure is normal now, currently not showing any drug interaction with the CHF, as she has normal cardiology and normal blood pressure. After pregnancy, she gets higher HbA1c level, which shows she developed diabetes type 2 and she desires for depot. So, what is plan? The pharmacological management says that according to the patient history, patient has HTN and CHF. Currently, both are normal, so no medication change will occur. For Depo-Provera, which is actually a medroxyprogesterone acetate, is not suggested for type 2 diabetes and obese women because they become more resistant to insulin after this injection. So for obese diabetic women, IUD with copper or levonorgestrel releasing IUDs are suggested. There are two types of IUDs. One is hormonal based and other one is copper based. Usually hormonal IUDs are not suggested in diabetes because they have further contraindication with insulin. So copper bearing IUD, that is T380 Paragard, is suggested. It doesn't cause weight gain and it's hormone free, provide long term birth control, that is up to 10 years. For diabetic patient, if patient shows side effect with IUDs like bleeding, irritation, nausea, and several other side effects, so oral pill is suggested which has progesterone only, that is desogestrel 75 mcg 1 tablet by oral is suggested. And for increase HbA1c, metformin 500 milligram by oral after 12 hours with meal is suggested. For non-pharmacological management, uh, patient is advised for exercise and low fat meal as she is obese. So as patient is obese, so should focus on eating like lean protein, high fiber diet, less processed carbs, fruits, vegetable, low fat dairies, especially, and healthy vegetable based fats such as avocado, nuts, etc. Uh, Further manage her carbohydrate intake by concerning with dietitian. So this is all from my side.